Over this past weekend, there were times when more than 50 Toronto Paramedic Service ambulances were out of service in hospital, waiting to transfer their patients to the care of the hospital and subsequently return to responding to calls as required. Chief Raftis and the Toronto Paramedic Services management team continues to work with hospital partners to quickly release paramedics from hospitals so that they are available to respond to emergency calls as very quickly as possible. This work and these discussions are continuing.
Our paramedics and other first responders are working together to adapt to this temporary situation, including cooperative arrangements to make absolutely sure that people with urgent health situations receive the service they have the right to expect. While our emergency management group review these challenging numbers every morning with Chief Raftis, any life-threatening call remains the top priority, even if response times to non-urgent calls may be altered from time to time.
City officials say they're doing everything they can to maintain emergency services, with life-threatening calls obviously the priority, but the backlog at hospitals now proving to be the biggest challenge facing paramedics.
Delays in offloading patients are leading to critical situations like the one we saw over the weekend, when no ambulances were available to respond to life-threatening calls. Joining us now live to discuss is Mike Merriman, Paramedic Services Unit Chair for CUPE Local 416. We appreciate you making time this evening, Mike. What is the situation for paramedics across the city?
Well, the situation for paramedics, well, in the service in general, it's very dire right now. The paramedics are basically feeling defeated, totally demoralized. They're exhausted. Basically due to low staffing levels and unavailable service calls. There's just not enough staff out there right now.
Yeah, tell us more about what happened this weekend, what that code red really means. There were 50 ambulances tied up in Toronto itself.
Exactly. Well, the code red was basically because a life-threatening call came in at 6:38 p.m. on the Saturday night, and there was not an available unit to send. So that's what prompted the code red, because that means there's not an available unit in the city, especially if it's a high priority call. Then obviously they're saying that they will service, but there was not an available unit in the city at that time. Now, to speak to the 50, they're saying 50 ambulances that were tied up in hospitals on offload delay. The union is not disputing that. And, I'd like to say, with all due respect to Chief Pegg, and I do have the utmost respect for the man, I'm not sure how well he's been briefed, being that he's the fire chief, how well he's been briefed on the history there of offload delay within the city. That's nothing new. We've been experiencing that for years, off and on, to certain extents. And the union has been warning for years as well that there is absolutely no surge capacity in the system to deal with the eventuality of a major event happening, which we are obviously in right now. And here we are. We've been chronically understaffed and underfunded for years. And to what I would say to Chief Pegg on, or Mayor Tory on the 50 ambulances that were tied up on the weekend in offload delay in hospitals, they should have had another 50 ambulances out there to be able to compensate for that. We've been warning about this for years.
Yeah, and we've heard that we're stretched too thin. Paramedics are going from different districts to respond to 911 calls, which adds to more delays with travel times. Can you explain the offloading patients, Mike, to our viewers so they understand why our paramedics are tied up?
Absolutely. Basically what that is the paramedics show up at the hospital with a patient, and if there's no bed available, a hospital bed, to transfer that patient to hospital staff, then that patient will remain under the care of paramedics on their stretcher until such time as they can get a bed. So obviously they can't get out of the hospital to service another call with their stretcher freed up until that occurs.
So Chief Pegg is saying that the city is looking at trying to improve that situation. Do you have any ideas of what that would involve?
I have no idea, unless Chief Pegg can magically find more hospital beds, then I'm not I really have no idea how they're gonna solve that situation. And again, that situation has been around. Offload delay situation, we've had that in peaks and valleys for years. Granted, they're in a peak right now, but they should have built a surge capacity in the system to handle that.
Mike, I want to ask you about this idea of sharing resources, because obviously this is not just a problem here in Toronto. We were hearing, Durham was using resources from Kawartha Lakes just a few days ago. Can this go on this way? I mean, are we going to get to a point where we just can't share resources anymore?
I hope not, but it's not looking good. And my concern is, with the life-threatening calls, I mean, paramedics save lives, but we need to be there. We need to be able to be there in a timely manner to save the life. And, I do have concern that if things keep going the way they're going, somebody may unfortunately die as a result of not being able to get an ambulance there in a timely manner. And I would like to maybe try to explain something to numbers here when you mentioned Durham that, may put it in a better perspective for your, for your viewers. The Durham situation you spoke of was last week, I believe. They run 30, according to their chief, they run 30 ambulances in the region of Durham normally on a night shift. They dropped down to 28. They only had 28 that night. A lot were admittedly apparently tied up in offload delays, so they had to bring a unit down from York Region to service a call, actually from Markham, York Regional Ambulance Service, a car out of Markham, to service a call in Curtis, which is actually where I live. But I would go back to say, even in the best of times, pre-COVID, 30 ambulances for a region geographically the size of Durham and a population of some 425,000, I think is ridiculous. But to put that to add to that, just for point of perspective, Durham runs 30 ambulances on a night shift. Toronto runs 60, if they can get 60, because they've dropped down to as low as 30. But if you have Durham running 30 ambulances on a night shift with a population of 425,000, and you've got Toronto running 60 ambulances for a population of, 3.5 million? The math doesn't add up. I mean, in that respect, Durham's in a lot better shape than Toronto is. It's just chronically understaffed. And it's come back to bite everybody.
Mike, we appreciate you offering this perspective and your insights tonight. Thank you for making time.
Okay. And if I can make one more comment, again, no disrespect to Chief Peg, but I mean, I honestly see from the city here, it seems like a little bit of scapegoating to me to keep blaming this on the hospitals. There's no doubt the hospitals are a major factor in this, that we can't get offloaded. But again, they have to take some responsibility that they haven't staffed appropriately for a crisis that we're in right now. And I thank you for your time.
Mike Merriman, QP Local 416, we appreciate your time. Thank you.
You're welcome. Thank you very much. And stay safe.
It's really, really important. And we've seen the numbers of mental health needs rising rapidly. We know that it helps students to be in school for their mental and physical health. And that is why our government, and particularly Minister Lecce, our Minister of Education, have done everything that we can to make our schools safe for students.
People say this, but it is really the best place for kids. In normal circumstances, we understand parents' concerns. The parents need to know that school boards are doing whatever they can with what they have, and that we will be working closely with our public health units to keep our kids as safe as possible.
Our members are feeling actually disrespected by the Premier. For us as a federation to be finding out over Twitter, over social media, by reporters that we're returning to in-person learning is really disrespectful for our members. They've been on the front line of this pandemic. We've had no consultation. We understand the government was going to review and have a look at what's happening and to see what's changed. And as far as I understand, numbers continue to increase. We're seeing a rise in young people being admitted to the hospitals.
Late last night, the Ontario government announced schools will reopen for in-person learning on January 17th. While many Ontarians have been calling for this, others, including teachers' unions, continue to voice concerns about safety. The province says it's doing what it can to improve ventilation and providing PPE to ensure a safe learning environment. However, the government will no longer track cases in schools and won't notify parents of any positive cases. This as the Science Advisory Table is set to release some new information this week about school closures. So for more on this, we're joined this evening by Karen Bourne. She is the Assistant Scientific Director on the Ontario COVID-19 Science Advisory Table, and Dr. Abdu Sharkawi, Infectious Diseases Specialist at the University Health Network. Thanks to both of you. I know there are lots of opinions on this issue. Dr. Sharkawi, I'll start with you. How comfortable are you with in-person learning as of next week? I mean, really, how much has changed in 1 week?
Well, frankly, not enough, in my opinion. I think that there was a lot of anxiety and apprehension around New Year's, and I think parents and students alike were looking forward to any delay representing a significant movement in terms of improving safety measures. Look, we weren't going to be able to retrofit every school's ventilation system in the course of 2 weeks, but could you deploy enough HEPA filters to high-risk neighborhoods? Could you supply proper PPE, KN95, N95 grade masks to as many students and educational staff as possible? Could we facilitate more dosing of second doses of vaccines to those that are particularly in the age group of 5 to 11? I just think that it's a very tall order to try and complete in a 2-week period of time. And I don't know that it's achievable. And the argument shouldn't be about whether kids should be in school. It's very clear that kids should be in school. But the question is, should they be in school at a cost that is going to be very difficult to pay? It makes very little sense to open schools up knowing that contact tracing has essentially vanished, knowing that access to testing is essentially very difficult for most without having the financial means to pay for it. Rapid tests are not available as they should have been. And I really wonder, that single income household with a parent who may be a factory worker who depends on having their child in school, what's going to happen to them when their child goes to school in a class of 30 kids, many of whom are either incompletely vaccinated or not vaccinated at all, and they're sick 2 days later, and that parent has to come home from work anyways? I think this is asking for a little bit too much too soon.
I actually want to mention one of your tweets, Dr. Sharkawi, because I think it paints a picture of what we could see happen next week onwards. You said, "I can't explain to parents how a room full of 25 plus partially or unvaxxed kids eating snacks or lunch will avoid spreading COVID-19 to the entire class. At the same time, can you hashtag Omicron buffet?" I wonder, Professor or Karen, tell us about your reaction to hearing something like that. What kind of picture does that paint for you?
Yeah, so I think Dr. Sharkawi paints a picture of a very challenging time. We have widespread community transmission at the moment of the Omicron variant. And I want to take that example of that single parent factory worker whose child is, where their school is closed. They may not be in a safe environment in the absent, where there may be transmission in the environment where they are when their parent is at work. And what we're seeing is that there's widespread community transmission's happening inside, in the community setting, and schools, and we know this from global data, are a safe place for children, and particularly with many of the mitigation measures that are in place.
So, Dr. Sharkawi, are you going to be sending your kids back to school next week?
No. And this is a difficult decision. And I say this having 3 kids who are under the age of 11. I was very fortunate to have all of them now double vaccinated. But I worry about what the ramifications are. I understand that it's difficult to have kids maintain an online learning presence. It's unhealthy for them from an emotional and a physical standpoint. But are we really going to die on this hill right now instead of waiting to actually improve and bolster our risk mitigation strategies over the next few weeks and at least avoid the possibility of a crush of Omicron throughout many institutions, including our healthcare institutions and the hospitals that I work in? This is what I fear the most. I think that there is ample opportunity to improve vaccination schedules. There's ample opportunity to provide more PPE that's free and accessible. But saying that somehow we're just going to have to die on this hill right now, kids are going to have to go back because this is what they need, it just flies in the face of logic in terms of what's happening with Omicron from one day to the next. It just doesn't compute.
But respectfully, Dr. Sharkawi, there are other provinces in Canada, BC, Saskatchewan, Alberta. They've all sent their kids back to school and their case numbers look pretty similar.
Well, give it time. I don't think that we're all at the same pace right now in terms of what happens with Omicron. We saw what happened with Alberta in terms of them relaxing their measures in the summertime and what sort of catastrophic ramifications that had with respect to their ICU capacity. So don't assume that what's going on in Ontario is going to reflect what's going on in BC or Alberta at the exact same time. There is a little bit of a dyssynchrony in that. And listen, I'd love to be wrong, and I'd love to see how Omicron is miraculously not going to spread through communal environments like schools with kids that are unvaccinated, but I find it very hard-pressed to believe that that's going to be the case.
Okay, let's talk a bit about what might happen in the weeks to come. Professor Bourne, tell us about this new data the Science Table is working on releasing this week.
So the data that the Science Table releasing focuses on the harms of school closures. Ontario has had 27 plus weeks of school closures. That is longer than any other jurisdiction in Canada. And in fact, it's longer than most other peer countries, Western European countries in particular. So that is worth noting. And the data that we're sharing is Ontario-specific data that associates school closures, social isolation with increased incidence of mental health in children and youth in Ontario, particularly increases in depression and anxiety among children and youth.
So how do we weigh this, Dr. Sharkawi, when we look at data that says this is obviously harming our children? How do we rationalize keeping them away from classrooms even longer?
It's very difficult. And, I think that part of the problem during this whole pandemic is the idea of binary thinking guiding our decisions, that it's either social and emotional and mental health or an education and safety from an infection control standpoint. And that's really something we have to get away from. We have to try and aim for and. We need the social and mental health and an organic learning environment for our kids to be married to an environment that's equally safe from an infection control point of view. We simply haven't done enough. We've had 5 waves to improve the ventilation status, and only now we're talking about putting in portable HEPA filters, at the 11th hour in high-risk neighborhoods and high-risk school board communities. This type of thinking and this stopgap sort of approach needs to end. We've got to invest in something that's going to be durable so that we don't keep going through this cycle and having parents and tenuous household situations hang in the balance. If we don't do that, we're simply going to revisit this again. It may not be exactly the same level of intensity. It may not be the same level of transmissibility. But mark my words, if we go about this the way we're doing it right now, we're going to wait for another variant to emerge in probably another few months' time, and we'll be discussing the very same things we're discussing right now. That's the reality of a pandemic virus.
Okay, Dr. Sharkawi, you mentioned a couple of important points. I want to explain what the government is saying. Minister Lecce gave us a bit of an explanation today about how they came to this decision. In a statement, they say that they've now shipped more than 9.1 million non-fitted N95 masks, more than 4 million 3-ply masks. They're also accelerating booster doses. We know that we've seen that for education workers, deploying another 3,000 HEPA filters to schools. You mentioned that, Dr. Sharkawi. Also giving away PCR tests to take home, but only to symptomatic people in schools. And they're going to make more rapid tests available in the coming weeks as well. Professor Bourne, you're part of the Ontario COVID-19 Science Advisory Table. Tell us, do you think these measures are enough?
So I think This is, again, a very challenging time. We have widespread community transmission of Omicron, and the question is really about balancing the risks between ongoing school closures, where we know we have strong data that shows that there are significant mental health as well as learning loss risks to children. These risks are cumulative, they are sustained. And I do think it's also worth noting from an equity perspective that these risks disproportionately harm children in low-income communities, in racialized communities, the very communities that have been so hard hit by COVID-19 infections and bad outcomes to begin with. So we're grappling with a very challenging and difficult situation. And I do think that there are many benefits towards in-person schooling. We know that in-person schooling offers children, particularly those children in these low-income and marginalized communities, access to food, access to a stable schedule, access to time away from screens, access to physical activity, access to socialization and peers. And they're doing it in a setting where they are masked, where they are being distanced, where they are cohorted, particularly among younger children in elementary and below, and where in many cases there has been optimization of ventilation and filtration. So I think that the debate in this province needs to shift away from perfectly safe towards let's balance the harms here in a situation, in a very challenging situation where Ontario is not alone. Around the world, children and families are grappling with these very challenging issues. But again, in Ontario, the debate is highly polarized between safe and not safe. I think we're really balancing harms here.
Okay, Dr. Sharkawi, I'll give you the last word here. Yeah, go ahead.
Yeah, with due respect, I'll take issue with the idea of, the organizational structure responding appropriately. During every single wave of this pandemic, what has happened is collapsing of cohorts. Cohorts have vanished despite the recommendations of experts from the Hospital for Sick Children. That advice was completely dismissed and ignored by our provincial government. The idea that ventilation was significantly improved is simply inaccurate. It's being improved right now, and certainly promises are good that it's going to happen, but it's taken 5 waves for these principles to become entrenched. And who has suffered from this? It's the same people who are suffering that are in tenuous, socioeconomically deprived situations and communities. It's the same ones suffering on both sides of the ledger. So let's be honest about this, and let's try and help both sides here. We can maintain both sides of the safety ledger here. We have to stop the binary thinking that has guided our path through this entire pandemic.
Okay, a very interesting conversation. We'll have to leave it there for today, but thank you both for joining us, Dr. Abdu Sharkawi and Professor Karen Bourne.
Thank you.
Thank you.
A differentiator in the past to the present is we now have rapid antigen tests in the hands of parents to be able to test their children twice to ensure that indeed they have or do not have COVID-19. That is going to be a layer of protection we didn't have. Of course, we awaited the federal shipment. We still need millions more that have been guaranteed. But the point is that is going to help empower parents with greater certainty to know.
It's great that kids are going back to school. That's really, really important. There still could be a little bit more sort of detail, clarity, concreteness about, for instance, will these rapid tests be available every week? Are they going to keep supplying the masks? And also to do with what are we going to do as, because the number of cases are going to keep going up. We know that. We've been told that by Dr. Moore and everybody else. As we start to lose more and more staff, what are we going to do then in our schools?
Ontario's Education Minister, Stephen Lecce, says the province will hand out millions of COVID-19 masks and rapid tests to students and staff next week when in-person learning resumes. But it won't be tracking COVID-19 cases in classrooms. Instead, public health will notify families when 30% of a school is absent. So what does this mean for our educators? Are they ready to go back? For this perspective, we welcome to the show tonight Karen Brown, president of the Elementary Teachers Federation of Ontario, Jason Bradshaw, secondary school science teacher with the Peel District School Board, and Mart Stiles, education critic and Davenport MPP. Thanks to all of you. Karen, I'll start with you. We spoke to you right after this news broke when we didn't have a lot of details about how the province came to this decision. You were opposed to schools reopening at that point. Did anything the ministers say today change your mind?
And today it's good that he's made some announcements around the N95s and the HEPA filters. So we welcome that, but cautiously. And we're moving very carefully to see what's going to happen on January 17th. Will all these things actually be there? I think what's concerning educators most now is hearing Dr. Moore most recently saying to us that in the next 6 to 8 weeks, we're going to see an increase in case rising. We're going to see an increase in community spread. That spread is going to occur in schools, and that's a concern. And our members are worried, and parents need to be concerned. What is the plan for staffing? What is the plan when absentee because of isolation, because of COVID-related illness? You're looking at Alberta, Saskatchewan. We look to the United States, what's happening in New York. It's going to happen in Ontario. And I think parents need to brace themselves for school closures, for continued interruptions, and having to be home with their kids.
Okay, there's lots to get to. Jason, I want to ask you, you're a high school teacher in Peel. How do you feel about going back to school next week?
Well, I certainly have mixed feelings about it. I think we all want kids to be in school. As educators, we want to be back in school ourselves. But again, there's so many things about the plan that are just unclear, uncertain. There's a lot of very important, specific details and concerns that are not being addressed. Things like, for example, what happens during lunchtime in school? And there's no clear policy that's being followed by all school boards or all schools. For example, in many high schools, there's not enough room to have all kids in the cafeteria. It means that kids are eating all over the school, in hallways, on the floor. They're unmasked. We don't have indoor dining in Ontario right now, but if you go into a school during lunch hour, you might have over 1,000 unmasked students with unknown vaccination status all eating amongst each other. So there's so many concerns such as that one. And I think we do need more time to hammer out those specifics, especially when we know that case numbers and hospitalizations have not yet reached their peak.
So, Jason, what would you have liked to hear from Minister Lecce today that you didn't hear that would make you feel more comfortable about going back to school next week?
Well, one thing is I would like to have schools and the ministry once again reporting when positive cases occur in the classroom so that parents have enough information to make an informed decision about whether to send their kids to school or not. Minister Lecce mentioned giving people access to the rapid antigen tests as a layer of protection, but really that's not a layer of protection. It's more something that helps after the fact. If you're using the test, it's probably because you're symptomatic, in which case you shouldn't be going to school regardless. So I'm not sure how that's really offering protection. It's a good thing to have. I'm glad that more tests are out there, but there's just so many gaps in this plan that don't address specific concerns such as that one.
Yeah, that's a good point about taking the test when you're symptomatic, maybe not making the most sense for many of you who are going to be around those people. Mara, parents won't be notified of COVID-19 outbreaks, we're learning today, in schools until 30% of students are absent, COVID or not. What do you make of this policy?
Well, as I was saying earlier today, it's a situation where you can imagine if you're talking 30% of your average school, that's like probably about 300 students and staff off and absent, but we don't really know why, because there's not actually any requirement for testing or reporting of when you have COVID. If everything is being left to parents and staff to figure this out on their own. So that's a big piece of it. And then you think about it, and I mean this is real. You are more likely as a parent to know now if there's a lice outbreak in your classroom, in your kid's classroom, than you are to know about a COVID outbreak. And that's for real. And it's astonishing. And I think what parents, look, I've been saying since now for 671 days since the government first closed schools in March 2020, that the priority of government has to be to keep our schools open for in-person learning safely for our kids. And I think what parents were looking for today was some assurance from the government, some clarity that the tools would be in place so that schools could stay safely open, that people would be safe. And what you got today, I think, is not assurance at all. You got a lot of concern, actually greater concern now. I'm actually hearing that the government is flip-flopping on some of this already. I mean, it's a disaster. it's the equivalent of playing whack-a-mole in government policy when it comes to schools. And that's just not good for any of us. We're already living in difficult and uncertain times, and we need to be able to plan for our families and take care of our kids.
And speaking of this flip-flop that we've seen, Mart, are you concerned that, schools might open next week only to close again and create even more chaos?
Absolutely. I mean, obviously, again, I'm a parent of a kid who's in school too still, so I really want to see my child in school. I know it's better for their mental health and emotional well-being and for their learning. And I know that, like, most people in the system want that. But right now, I would say I am really concerned, especially about the fact that they are, just starting to maybe provide, they're saying 2 rapid tests for each of the elementary school students. But when is that going to get into their hands? That's going to carry us for about a week. I mean, I don't know what the long-term plan here is. And they're really not giving parents much confidence, frankly, in this decision. And so I'm very concerned. I think that it's going to be really hard. I think people will get sick. How sick, I don't know. But we will have a real loss of staff, as we are seeing in other sectors. And I don't think it's going to be, I don't think it's safe or desirable for our kids to be left, packed into classrooms without enough supervision. Anyways, I think we're really headed for some more difficulties. I certainly hope not, but they certainly haven't inspired much confidence.
Karen, what are you hearing from your members about their level of comfort going back to school after finding out there will be more rapid tests, as we've discussed? And now we know, the minister said today, every single classroom will have a HEPA air filter, and every teacher and staff member who would like one will get an N95 mask. Is that comforting?
Well, let's see what happens. Let's see. We know that perhaps maybe in the GTA area, our members are across the province, and we want to ensure across the province they're getting that. So we'll find out on the 17th if that actually happens, and if they do get masks, how long are they lasting? Is it for a week, 2 weeks, 3 weeks? What then? That's going to be a key factor. And HEPA filters, we'll wait and see. We heard they've been ordered, but for 3,000 to be already in every classroom and shared spaces. The kids are not limited to just the classroom. They move about the schools. So HEPA filters need to be in other areas as well. So our members are still very concerned. They're in large classes, large class sizes. I want to repeat that again, 30 to 40 kids. You and I are limited for establishments, restaurants, malls. There's capacity limits. We don't see those limits in the classrooms. That's a concern. Our children who are in kindergarten, they're unmasked, 30 to 40 of them. It's a concern.
So mental health, obviously also a big concern. That's something we've been talking about. Parents are really worried about this at this point. Jason, how do you rationalize feeling like you're not ready to go back to school when so many parents really would feel better having their kids in classrooms?
I fully appreciate that sentiment, and I know that many parents and educators ourselves do want to be back in the classroom. We do want kids back in the classroom. But if we're talking about mental health, we have to address the mental health issues of losing somebody to COVID or having somebody in your family who's sick due to COVID. And I really hate to talk about this, but over the last year and a half, I've gotten so many communications from students who have written me emails telling me that they can't complete an assignment or they can't attend class because they have a loved one who's in the hospital with COVID, or they themselves are positive with COVID and they're isolating and they can't interact with their families. And I know how difficult it is for young people to be limited in their socializing and how it's detrimental to their learning. But I can't speak enough about the pain and the suffering I've seen from young people who have actually lost people to COVID and what they take with them, knowing that maybe they had something to do with that exposure. And I just don't want to think about what can happen in a worst case scenario in our schools if we don't do this right and if we don't make sure they're as safe as possible when we return to them.
So, Jason, would a mandatory vaccination policy in schools make you feel better about going back?
I think it would make me feel better, and I think that we need to acknowledge that we already have several vaccines that are mandatory for students to have to attend public schools. And COVID vaccines have been approved by Health Canada. We know they're safe. We know they're effective. I don't really see any reason why they are not being included in the list of mandatory vaccinations.
Okay, Karen Brown, Jason Bradshaw, and Marit Stiles, thanks to all of you for joining us. We'll chat again soon.
Thank you.
Thanks.
When you consider the government's response or lack of response, we feel left out. We see how the government responds in other areas, Southern Ontario, other parts of the country. Here, there's nothing. Only our neighbors, the surrounding communities, all of them that are close by have responded. They have raised donations, they have chartered planes to bring us supplies.
Did you catch that? We feel left out. It's a really powerful statement from the health director of an Ontario First Nation battling a COVID-19 outbreak that's ravaged about half of its population of 400. The chief of Bearskin Lake First Nation adding he's disappointed by the federal government's response, saying that a handful of Canadian Armed Forces personnel were deployed, and that's not enough support.
The good news is the situation from a health perspective appears to be improving. According to the federal Indigenous Services Minister, there are roughly 50 active cases remaining. For more on what's happening on the ground and how much support the community of Bearskin Lake still needs, we welcome to CP24 Tonight MPP Sol Mamakwa. Mr. Mamakwa, thanks for making time for us.
Hi, thanks for having me.
That clip we just played was actually taken during your trip to Bearskin Lake First Nation exactly 1 week ago today. So before we talk about the situation on the ground right now, what was it like there last Thursday when you saw it firsthand?
You know, it was very, I think one of the things I noticed right away, I didn't see any children running around in the community. I didn't see any kids, and very limited people that I saw. Like, it was very ghost town-like. You know, the workers that I talked to, probably about 25 of them, you know, they were tired. It was emotional. They were overwhelmed with the work that they were doing. And when I landed, it was like minus 30 degrees. So, it was bone-chilling cold when I was there. So I knew I was very sad to see in a community in that state whereby, where they felt that there was no end in sight.
For people that haven't been to Bearskin Lake First Nation, tell us about some of the challenges being such a remote community and some of the problems with accessing help in situations like this, where it's a very clear healthcare crisis.
We have to remember, the nursing station there's some nurses there that are federal nurses that provide, the care for the community. But, we have to remember the closest physician, the closest doctor, the closest hospital is about 400 kilometers away.
Wow.
And when you go into a health emergency, you have to get a plane, which is orange, to provide that, because we have no ambulances, we have no that type of care. So, and then not only that, airport is only the runways are only the lifelines to access education, healthcare, food, everything. So that's people that don't understand the flying communities. That's it's very limited access, and the cost of living is very expensive up there.
Bearskin Lake, Sol, is in your riding. What's your understanding of the situation there now that thankfully many people have started to recover from COVID-19?
And I think, again, they're in a recovery stage, recovery mode. This evening, I did talk to the leadership, and they said that there's 47 active cases, and the peak that they had was at 221 cases of positive cases, and those other ones that have been resolved, but they're still on lockdown because the other half hasn't had COVID yet, so they don't want to open too early. So right now they're just at that stage to try to recover. Not only that, just the mental wellness, the mental health, and make sure that everybody's slowly get back to normal.
I know one of the biggest challenges was having somewhere to isolate. Essentially, people who are negative and positive were forced to live in the same household because there aren't, these isolation centers. Someone in that video that we showed a couple minutes ago spoke about the need for things like even portables to allow people who are COVID positive to isolate. How big of a challenge was that?
We have to understand that these First Nations are the communities are overcrowded. They already have overcrowding in their homes and the communities. So, when you have multiple families in each home or house, that creates a very a challenge. And I think, and also not only that, when we have boil water advisories in these communities and these First Nations, it is a challenge. So it's what has happened, what we saw here with COVID-19 in Bearskin Lake, really compounded the issues that that the community already faces. Like it's almost like a crisis on top of a crisis on top of a crisis, and that's just that's not acceptable. And we need to be able to move forward and go in a way that they can start recovering.
So, Mr. Mamakwa, the Prime Minister, Justin Trudeau, was peppered with questions about the types of support that the federal government is offering Bearskin. This happened yesterday. Tell us more about what that support looks like on the ground and whether people in Bearskin Lake actually think that's enough.
I know that initially, I think it was Saturday when I first heard that there was boots on the ground, that they had 3 people from the military that came in for a few hours and checked things out, and then and I think they had a total of 7, which were, some of them were local Canadian Rangers, part of that program that they have, and that was too late. That was just a bit too late, and I think when on the height of the crisis, where they needed them right away, they should have acted sooner. And I think because I saw when I was there, I saw the emotion. I saw the how overwhelmed they were, and I think we need to be able to see more resources on the ground to help the frontline workers, the 25 people that were taking care of the 400 plus people that were there. They needed to be there sooner, and I think certainly I know I've seen some news about outlining some of the funding that they put in and some of the resources that they have put in, but that was not enough either.
So what's the impact on people who are living in Bearskin First Nation when you say that funding, that help came in too late?
And I think, like they're just, when I talk about that, the frontline workers are the ones that were getting sick. And I met with the ladies. There's about maybe 10, 12 ladies in the community that sorted out, delivered all the supplies that came in, from the surrounding communities. And I saw the emotion. I saw the tears in their eyes when I was there, when I got to speak with them, because I know they were very tired at that point. And this was like a week ago today. And, that they should have been there, Friday, Saturday, and that would have, I think, it just makes people sick. And at that time, when I saw the chief, he was negative when I saw them a week ago, but it was 2 days later he got positive. He became, he had COVID, and that's, and that's because he was isolating with his family that were negative. And there's, and I think it's important that, we, the children, the families that we look after them, make sure that the elders were cared for, and make sure that everybody had a warm place to stay. And even that night I traveled out, that the power went out for a few hours, 3 or 4 hours, and that's what I mean by we needed people there, and that's we need to be able to get them stay warm at least.
The Rangers right now, they're only deployed for about another 10 days until January 23rd. The federal government has said it could be extended a little longer, but the chief said he might need help for up to 6 weeks. So what happens now?
And I think that's all part of the recovery plan. And, I'll be working, I'll be talking to him and, what help that he needs and to be able to try and ensure that there's proper supports. Example, when I was there, there was no people to make checks for pay, for your pay, but everybody was sick. And everybody was at different levels of sickness or different levels of the symptoms. And, some of them were fairly sick, but not enough to be medevac by airlines. But I think that's the work that needs to be done in the coming days, the coming week or so, to be able to determine on the next steps.
And to get this community back on its feet. MPP Sol Mamakwa, thank you so much for your time tonight. Appreciate it.
Thanks.
Miigwech, thank you.
Miigwech.